We're presenting data here at the American Diabetes Association Scientific Sessions that examines CGM satisfaction in type 2 diabetes in the DIAMOND study. And what we find is, in fact, very, very high levels of treatment satisfaction, in fact, higher than any previous study that I'm aware of. And we find that that satisfaction is equivalent to what we see in folks with type 1 diabetes. So the news is actually very good. When in the data we're going to be presenting here, the major difference between the type 1s and the type 2s is that type 2s actually perceive somewhat more benefits to CGM than type 1s. And those benefits really have to do with feeling that they've learned something new about how how their own actions affect blood sugars, things they didn't know before. Things that often people with type 1 are probably very conversant with, given their experience with blood glucose monitoring and probably living longer lives with diabetes as well. So I hope this is really striking to healthcare providers as they may be reticent about the use of CGM data for type 2s, that this, at least from the point of personal treatment satisfaction, there's a huge amount of enthusiasm. Also, we saw in the DIAMOND trial, in particular in the type 2 population, again, people didn't stop using this device. They kept using it. And again, the enthusiasm was very high. My recommendation for healthcare providers when they have patients who are on insulin, type 2 patients on insulin typically, who are, they suspect, struggling with actually following recommendations. They may be reluctant to titrate up to the necessary dose, they may be falling off, they may be discontinuing. Really, we know the single most important strategy is to stay in touch with patients. That when people fall off the wagon in some degree, it's because they feel like they're on their own with their diabetes, on their own with insulin, and literally more frequent contact with patients, whether that means more frequent visits, text messaging, it can be very virtual, just being in touch. And for the patient to know that there's someone out there who is rooting for you or holding you accountable can make a huge difference. We know another important way that can help people to stay active with their insulin and not fall off the wagon is to provide them with some sort of ongoing tangible feedback that what they're doing is actually making a difference, whether that's through glucose monitoring or graphical display of A1Cs. But there is unfortunately a tendency for people to discontinue or to be reluctant about titrating because they just don't perceive any benefit. They have concerns about, if I take more insulin, it must be bad for me. If I can take less insulin, maybe that means I'm healthier. Those discussions need to take place with their healthcare provider to help people understand that's just not true. But to help people to see, to point out where there are tangible benefits. And that's true for any of us. If you're trying to make and maintain a positive behavior change, odds are pretty good you'll keep it going if you've got some ongoing positive, tangible sense that what you're doing is making a difference. So when we can help people see that, oh, remember you used to be more tired than you are now, or remember that your mood wasn't as good, that your blood sugars are better, all those things, again, it's one of what we do when we stay in contact with people, how we help people to see that their actions are making a difference is really probably the most effective way we can help people be successful and stay with recommendations.